What's up, Dr. Patrick?
All right. Hello, everyone in the world. Thank you for joining us. We are here. We are live. We are talking about sleep today. I am joined by my colleagues, and we are all in different parts of the country. And we're talking about sleep. So before we begin, I do want to have my colleagues introduce themselves. So I want to start with Dr. G.
Hi everyone, I am Dr. Gertrise Thomas, also known as Dr. G, graduate of National University of Health Sciences, and one of my passions is stress and stress management, and I'm just happy to be here today.
You always happy.
I am.
Thank you for joining us. All right, let's go with Dr. Jones.
Hey everybody, Dr. Greg Jones here. I am a 2018 graduate of SCNM out in Arizona. Currently, my area of focus is in a lot of hormone replacement, regenerative medicine, peptide therapy, IV therapy, and just a lot of functional medicine and wellness. So.
Awesome. Damn. Here right now, I should just leave.
No, Dr. Woollery, go ahead and introduce yourself.
Hi, I am Dr. Nate Woollery. I am a recent graduate of National University of Health Sciences as of 2019 December.
Congratulations. Welcome to the family.
Thank you. And I still reside in Chicago. I do not have a set direction specifically of where I want to go, but I heavily do want to focus on men's health. I think even though I wasn't part of the talk last week, which I really wish I was, men's health is it's scarce in medicine. And I think there needs to be more outlets for men in general for them to be able to reach out to. I just think in a world where a majority of medicine is primarily focused or geared toward the female species. Hey, I'll play with you later. I'm sorry. I'll play with you later, okay? Give me 1 second. Sorry. Goofy, you can grab Goofy. He's in my room. I'm so sorry. I really think I'm really passionate, just below passionate.
All right, let me let Dr. Thompson introduce himself real quick.
Okay. Happy, what day is this? Sunday? Happy Sunday, everybody. My name is Dr. Patrick Thompson. I am founder and chief healing officer of the Whole Kingdom Wellness, holistic health solutions based in Miami, Florida currently, where I focus on a concierge health consultation practice, as well as doing initiatives in the community that involve around faith and health. So I'm happy to be here and look forward to the conversation tonight.
Excellent. And I am Dr. Turshá Hamilton. I am currently located in New Orleans, Louisiana. My focus is diabetes, hypertension, and digestive distress. So all things digestion. And part of that discussion is around just those foundational things that make us healthy and well. So I am big on education as well. And sleep is huge. Sleep is definitely a part of every aspect of our medicine that if we are trying to help people get well, then we want to make sure that they are getting good sleep. So docs, let's talk about sleep. When you're seeing a patient, what do you consider, or what do you consider a good quality sleep? Anybody can jump in.
Can I ask one question before that?
Yes.
Dr. Patrick.
Yeah.
I just want to know what rocket did you get to be up in space like that? Because
Oh,
I've been trying to get out off this earth for the past 25 years, and you over here floating with the stars.
yeah, man. Just go hit him your virtual background, man.
Shoo. Okay, I'm done. I'm sorry.
Yeah.
It's a dope background. I like it.
Yeah, it's a little different. Oh man,
All right.
so for
Sleep.
it's all good. So for me, you know, I kind of, you know, my target goal for most of the patients between 7 and 9 hours, right? But again, everyone's different, right? Some people function better with a little less, some people a little bit more. But not just the number. The questions I'll ask is like, hey, are you having any difficulty falling asleep? Are you waking during the night? And more importantly, how do you feel when you wake up? Because I have a ton of patients like, man, I sleep 8 to 9 hours, and well, how do you feel in the morning? And like, yeah, I feel exhausted. I'm like, well, that's not good sleep. You know, so it's a little bit more than just, you know, I like the number with an asterisk on it, so to speak. Yep.
Yeah, I agree with Dr. Greg. I mean, you know, he hit the nail on the head. You know, what I would add to that is just, in my experience, there are so many people in this world, in this country, in this world, that don't even remember the last time they woke up refreshed. Don't even remember the last time that they wake up, but it's kind of like, I still feel tired. You know, I mean, and I'm sure many of you all who are on this panel and those may be listening, if you just think about yourself or those you know, and you know, you ask people you speak to frequently, hey, how'd you sleep? And how many times have people said, I feel refreshed? It's going to be far too few, and so we have a lot of work to do in that regard.
Yes.
Open the door. Open the door.
Dr. G?
I would agree. I definitely want to make sure that patients are waking feeling refreshed, making sure they're not having
Open the
difficulty
door,
getting to
please.
sleep, and not having trouble staying asleep as well. Like, you know, the other gentleman said that, you know, everybody's different. So some of us may be able to function on less sleep. Some of us may be able to function on more. So it's all about making sure that you know what works for you, and finding that balance there.
Yes. Dr. Nate? Dr. Nate?
Kind of stepped away for a second.
Oh, okay.
Yeah, we gotta learn how to use that mute button.
Okay, got it. All right. So, and for those of you who are watching live, thank you for joining us. If you have questions, please be sure to put them in the chat box. The goal is not only for us to give you information, but to answer your questions. So I'm monitoring the chat. Place your questions in the chat box, and we will go from there. Dr. Nate, what is your definition of good sleep? I'm trying to unmute you. Hold up, you're muted.
Mute.
You're muted. Unmute yourself.
Sorry.
All right.
You know, that's a really good question, and it's largely based off, you know, subjective finding. I mean, good sleep for me may not be good sleep for somebody else, and for me, I am technically a night owl, and I think it's because, you know, the years of bartending, I was always up late, and I would think going to school and incorporating a new schedule, which would force me to go to bed at an earlier time, would help. But I still find myself going to bed at 2, 3 o'clock in the morning and waking up at 7. And so I wouldn't say that I was tired when I woke up, but I didn't feel well rested, if that makes any sense. Mm-hmm. But sleep was never, I never had an issue with sleeping at all. I actually enjoy sleep a little bit too much. Sometimes I can sleep for 10 hours a day and wake up and still be tired. And I think for me, a lot of times when I do choose to sleep is to procrastinate on, you get that? A little joke there? To offset a lot of my responsibilities, even if whether it be overwhelming or intimidating, or I just plain out just didn't feel like doing it. I know I used sleep as an excuse to finagle myself out of certain situations.
Okay. Okay.
Does that answer your question?
So when you're talking to patients, and
Okay.
you are getting a history, when they're talking to you, what do you consider good sleep, or what are you trying to help your patients work on?
Okay. Talking to a patient. So let me think of anybody particular at Salvation Army. Because I've dealt with a lot of people who had issues with sleeping, and a lot of it stemmed from, their addiction history, and living in uncomfortable places, because a lot of these patients were used to living out on the streets where they had to keep their eye open every hour, just because, they're afraid of somebody coming and stealing something that's theirs, or being robbed, or just getting randomly beat up for no reason. I think sleep for a lot of people, especially if they're used to living a certain way, makes them very vulnerable. And so subconsciously, they do not allow themselves to fully immerse themselves in a restful sleep. You know what I mean? Okay. So they'll sleep, they'll wake up at the slightest drop of a pin. It's just one of those defense mechanisms. Like I said, for me, with sleep, I didn't sleep because I needed to. I slept just because I wanted to. I did it just to make an excuse to not do something. And I do realize when I don't get a lot of sleep, or I don't get enough sleep, I tend to make the smallest mistake, the minutia of things I would typically miss. Like, I'm trying to think of a very good example. Leaving my keys in the door. I never do that. Never ever do that.
Right.
Okay. I mean, that's a bad example, but
No, it's actually a good example, and that segues into the next thing. So we talk about sleep, we talk about the importance of sleep, but unfortunately, the culture in this country is sleep when you die. Always grinding, always hustling, and for caregivers, whether caregivers or leaders, part of the issue in this country is that sleep is not valued, or sleep is the thing that we can put on the back burner. Let's say parents, especially of very little kids. We give all that we can to the children, and then the children go to bed, and that's when we are able to do what we need to do. Or if we have, careers, we are doing what we need to do in our careers, and we have to eke out the last little bit of time and energy to make sure that we get the last thing done. And so sleep is not valued. Sleep is not prioritized the way that it should. What are some of the manifestations of that you have noticed? For example, what are some of the things that you've seen manifest in your patients because of lack of sleep?
Irritability.
Irritability. Perfect.
Irritability.
Yeah, I think when we think about that from a patient perspective, I mean, I've seen, one of the things that, a few of the things anyway, is stuff like chronic fatigue. You see cardiovascular issues, hormone imbalances, things of that nature, which then begin to cascade into other issues.
Yes.
And so, Dr. Turshá, you mentioned this ethic, if you will, that we proliferate in this country, that sleep is for losers. I got to grind. And I hear people saying that, and I don't listen. I don't not having a real good work ethic. That's good. But I think one of the things that I try to impress upon people is that we got to make some priorities in how we make those type of decisions. It's good to have a good work ethic, right, but at what cost? And I think one of the reasons why people continue to push that is because there's a lack of understanding of what that really means. And I think we also have sort of an invincibility type of mentality. If I grind, I get my ends, I make my paper, I do this and that, then I'm good. Well, the reality is you might have a lot of paper then, but you're gonna have to pay for some medical bills at this point.
Right.
That's what's gonna happen. And so, when so what I try to impress upon people is, you need to understand what that's doing to your body.
Right.
And the priority is, you got to make a decision of what your priority is. Do you want to live? what quality of life you want to have as opposed to making a certain productivity level. And I'm glad, I'm going to say this, I'm glad that you said in this country, because what I've seen is that a lot of other countries, you know, they have a better understanding of that in some countries, I would say. And we over here grinding ourselves. You know, we got 30-minute lunch after work, and they got, I remember going to South America. These people was on lunch for 3 hours. You know, they went and picked the kids up, wife, kids, and everybody was on a mat or something, or blanket in the middle of the downtown eating ice cream and sandwiches. I mean, you know.
That's what she was doing.
Okay. Dr. G.
I would say, because Dr. Patrick talked about productivity, but actually when you lack in sleep, you can have low productivity. Like you're not able to perform at your best. You may even have like brain fog, so you're not able to think clearly. So even though you think that you are on the grind, you're actually grinding at a lesser capacity because you don't have that sleep to regenerate and reboost yourself. So that's one thing, especially in school. A lot of people get in school and they're just going, and then it's like, well, why am I not performing like I used to? It's like, well, you're not taking care of your body. Like that is your first priority. You can't give from an empty cup. So you have to rest and regenerate. So I think we miss those things. There's like our productivity falls, our ability to reason falls, like, you know, we mentally and even emotionally, because sleep can affect your emotions as well. I think Dr. Nate said irritability. You can actually, you're more susceptible to things like anxiety and depression when you're lacking in sleep as well. So, you know, paying attention to those cues, like, yes, we're a grind out society, but like Dr. Patrick said, at what cost?
Yeah. Dr. Jones, were you about to say something?
You know, just because a lot of people call me Dr. G, it threw me off a little bit. So
I did not know.
I was like, it's my turn. It's my turn. I was like, oh, let me back up there. Let me back up there. But no, what I actually think about that, the irony is the most successful people sleep a lot. If you look at professional athletes, if you look at successful, you know, business leaders, they talk about how much they sleep. And the people that are on this team no sleep, they're usually unhealthy, you know, and what Dr. Nate talked about the whole, you know, forgetting where your keys are, right? Not, you know, and most people don't know. If they knew what sleep does, if you knew that when you're in, you know, REM sleep, stage 5 sleep, that's when you're making new memories. That's when you're, you know, those neurotransmitters are replenishing and restoring. You know, hormonal, you mentioned that. That's in that REM sleep, that's when your testosterone levels increase. And then, you know, in their deep sleep, you know, people that are having, you know, pain issues and recovery issues, when you're in that deep sleep, stage 3 and 4, that's when your growth hormone spikes. That's when your body's repairing muscles and injuries, right? So the people that are saying that aren't the ones that are the most successful. Though I don't know why they're saying that. Like, you need to sleep. You know, I was almost forgot.
Intimidation.
Yeah, I almost did the Sam Jackson. I don't know if you ever seen that reading he did.
Yeah, I know what you mean.
Next time you just go and do that. Go and do that.
Go the F to sleep. Like literally, you know what I'm saying? Like it's seriously though, like it's so important for your health. And I think that we need to kind of change that paradigm and let people know that sleep is important. But
absolutely
on it. And it can't be, you know, something that becomes normative. You know what I mean? And I think, you know, so many of us have been dealing with this stuff and had not addressed it for so long. We begin, I only sleep this amount. That's what I do. And the reality is, no, you know, you probably should do some more sleep, but you're so used to not doing that, it becomes a normative thing. You know, and I think Dr. Nate can attest to this, you know, him being fresh out of school. My experience with that, I was operating, you know, even when I got out of school, I had a sleep deficit, you know, that I was trying to I felt like I was trying to make up for. You know,
I don't think I've made up for it yet.
Let me tell you, at 6 months out of school, I called one of my classmates, and I was angry. I was like, they lied to us. They told us that 3 to 6 months out, we'd be refreshed, we'd be done, and we'd be ready.
That was a lie.
She was like, no, they didn't. She said it takes at least a year. I said, a year?
Yeah,
Where did I get 6? So, you know, And
you got to be purposeful.
I was about to say that if you are actually doing the things to regenerate. So when we get out of school or we get out of whatever stressful situation, especially long-term stress that we're in, if we don't purposefully create healing routines, then we're still not going to be able to rejuvenate, because we're still working in, as Dr. Patrick said, in that deficit, right? And so for those of you watching, part of the healing journey and part of restoring sleep is not just let's get some sleep tonight. It's creating those rituals around
Right.
sleep, first of all. And then the next thing would be, why are you lacking sleep? And starting to reverse those things. And so there's a lot that can cause a person to lack some sleep.
I agree.
So anybody, Dr. Nate?
Yeah, I wanted to say, I mean, awesome, valid points. I wanted to touch on what Dr. Patrick was referring to when he said about the mental state of sleep deprivation. I was trying to word this in a way where it doesn't sound too sophisticated, but
hey man, say what you gotta say.
I know. I'm trying to figure out how to put it into words. I know. I'm trying to figure out how to put it into words. I had it in the tip of my tongue. Oh, here we go. So now, as last week's discussion, regarding the men's health, right? I wasn't there for the discussion, but I would assume that you guys have talked about the over amount of pressure men deal with on a daily basis when it comes to responsibilities and all that, right? And so my correlation to the sleep is that men are expected to persevere no matter how hard or difficult life may be. Like if you have a family and kids to take care of, or a job that needs you, men are more likely to sacrifice their sleep than females, just to make sure everything. Hear me out. Hear me out.
We're listening.
Okay.
Tread carefully. Tread carefully.
Okay. What I mean by that is that men will forego sleep for the sake of taking care of their own. And this will also begin to cascade or herald into mental health issues, because men by far they're stubborn. Okay. I wasn't here for the talk, but I mean, I would like to emphasize that men, and me being a man myself, they're scared to go to the doctors. They see it as vulnerability, weakness. Okay, they're supposed to withstand everything that comes their way. We live in an age of toxic masculinity, where men can't cry. They can't show emotion. If we were allowed to permit men without any fear of ridicule or being ashamed to just express their emotions in a healthy way and to cry, because men cry in the dark. I cry in the dark. I don't cry in front of my peers, but I make sure I go into the bathroom light and then click, bam, you know what I'm saying? I'm letting them tears flow. But it's because when I'm not around anybody in fear of being judged or looking, as me being weak or just being too sensitive, even though I am a sensitive person, I own that. But men really don't know how much they put on themselves unless they actually if they actually sat back and look at how much responsibility they give themselves and what they're accepting from other people. Right. This contributes to a lot of their sleep deprivation, because Absolutely. Even when you're not consciously thinking of why you're not sleeping, you have these unresolved issues, whether it be trauma or projects that need to be done, stuff that needs to be done around the house, trying to make your wife happy, trying to make sure the kids are taken care of. You know what I'm saying? There is a plethora of factors that contribute to somebody not sleeping well or lack thereof. And even when they do sleep, it's not thorough. you know? And what happens the next day? They wake up with the same exact issues and they just carry on like nothing happened. And what happens is this becomes, it stacks, you know what I'm saying? It overflows. And this is where you see, you know, major depression manifest, and anxiety, and quick to anger, you know, and how, and failed relationships and marriages, you know, being drawn away, you know, or drawn away from your friends and family, you know, because you're not dealing with those internal factors, or dealing with the external factors that are making you feel internally this way. You know what I mean?
Yes.
Sleep is so underrated. I think in Western medicine, when you go to a doctor's office, that should be one of the first things they talk to you about, you know, and they don't. But like when we see our patients, that is a determinant. That's a huge determinant. But it's to the point where people don't, or they fail to see the correlation between sleep and chronic disease and mental health issues, because there is comes around full circle, and it needs to be talked about more.
So let's talk about some of that. So I recently did a summit on hypertension, and Dr. Gertrise at Dr. G and Dr. Thompson were two of my guest experts. And in the summit, we talked about, you know, different things that cause hypertension. And of course, you know, stress and diet and, you know, exercise or lack thereof, mental health, autoimmunity, but sleep is a huge part of it. And, you know, so this is one reason why we want to make sure that we talk about sleep and how it can affect us. I do have a question, so I do want to, I have a couple actually. So Wanda, thank you very much, Wanda, for posting your question. She says, I was already having problems sleeping and just received the CPAP machine 6 days ago. And I'm sleeping worse with anxiety. What can I do?
Let me ask this question, and I can't really hear her. But one thing I would suggest, you know, with the CPAP machine is to make sure, number one, that you have the right settings on it, because the settings make a difference in terms of the amount of air that's being pushed in, and secondly, as we've already established, there are a number of factors that go into how we sleep, and you know, we use the term sleep hygiene to talk about how, you know, what our routine is for sleep. So what I would say to what's the name again? I forget the name. Wanda. What I would say to Wanda is, number one, you know, look at that, you know, ask your doctor about the settings on the machine to make sure it's adequate. And secondly, let's attach this sleep issue from some other factors. So when we talk about sleep hygiene, we talk about, you know, what's going on before you go to sleep, during your sleep, and, you know, sometimes after. But, you know, are you watching TV? Are your lights at a certain level? I know personally, when it's time for me to go to sleep, and, you know, there's something I've made a promise to myself to do more of that this year. Y'all pray with me on that, please. Is try to go to sleep between 10 and 10:30 and wake up, you know, try to get myself at least 7 to 8 hours. It's time spent in between. And so what that means for me is that, around 9 o'clock, you know, which is, you know, weird for a lot of people I know, when they call to me and they say, you know, want to FaceTime me, and they say, hey, you know, I can't see you. Well, I'm not turning the light on because I'm winding down. Yeah. Around that time, I'm winding down. I may get a little glass of something that will help me to, you know, a glass of the spirits, you know, that will help to, help me to wind down a little bit, or some I'm sorry, chamomile tea. Excuse me.
Chamomile spirit. Tea. Chamomile spirit.
Yeah, chamomile tea. You know. And also, you know, there's a variety of supplements and things of that nature that we can say to you that will help you. Magnesium is one to help you widen out those blood vessels and get that blood flowing. Looking at, we looked at, a lot of people know about melatonin. And there are a host of other things that, you know, if you want to know about it, I would advise you to kind of call us so we can really get into you.
Absolutely.
Get you what you need. But to look at those other factors along with that, that will help you to be able to sleep.
We'll talk a little bit more about sleep hygiene, you know, toward the end, more specifically.
Okay.
Anybody else have any recommendations specifically for her and a sleep app machine?
I would say, I would ask, because she mentioned she's having trouble sleeping because of anxiety. So is it that you have anxiety because you have the CPAP machine now? Like, is that causing the anxiety, or is it, you know, or is the condition that caused you to get the CPAP machine causing you to have anxiety? So I think one of the factors that you're going to have to look at, or one of the root causes that you'll have to look at, is like, what is causing your anxiety, and start from there. Like, where are you having anxiety? If you don't already have a therapist, I would recommend like diving into that with a therapist, and really tackling the anxiety behind that sleep deficit. That's going to be key in this situation.
It seems like, just from the way she typed it, and you know, correct us if we're wrong, but that the CPAP, using the CPAP machine was what caused the anxiety. So if that is the case, I would personally say, you know, as Dr. Thompson mentioned, make sure that the settings are well, because it could be like blowing too much air, and that could be distressing to you. So that's a huge piece. Anybody else have a tidbit before we go into the next one?
I do remember during grand rounds, fellow colleague of mine, Dr. Janae Williams, did a presentation on sleep apnea and chiropractic adjustments. Now she's using the CPAP. Yeah, it was really interesting. Basically, it was localized to the cervical region, obviously, but it was targeting the muscles engaged that are engaged while you're sleeping, including your accessory muscles for breathing. But apparently there's supposed to be some correlation between the tight just the
We can't
scaling.
see your face.
You can't see my face? Oh, they can't see my
your
face.
hand. Yeah.
Oh, sorry. The posterior, middle, and anterior scalene muscles, pterygopalatine muscle.
You talking anatomy that I
know. I'm sorry. I'm sorry.
I know.
That's the beauty of the new graduate. Remember things.
Yeah, I mean, your master. I mean,
like even, stuff on the side.
Stuff on the side. I mean, even your masseters, because some people, you know, chew. I mean, they bite their jaw when they sleep. You know. But long story short, I mean, she really didn't get too much detail into, you know, what she did, just because, you know, time restraints. But overall, she says, you know, like even the TMJ muscles, you know, TMJ adjustments have helped with the sleep apnea.
Thank you. Well, she actually mentioned that her machine is on the lowest setting, however, having the mask on her face. So just having the mask on the face, that can definitely, that's probably what's causing her anxiety. Any suggestions? So as Dr. Nate said, and I actually hadn't thought about that. So for those of you who are having sleep issues, especially sleep apnea, there are a few things you can work on, but talk to your local chiropractor or naturopathic doctor who does manipulations, because having manipulations around your neck and upper back can help improve the quality of your sleep in many cases. Anybody have suggestions about the machine?
Yeah, well, two things. Number one, I know that there are also manipulations sometimes that need to be done around the rib facets area. Okay. Sometimes you can't breathe fully because there's some restriction there in the rib areas, and so making adjustments there can also be helpful. Also, in terms of the mask, I mean, I don't know what kind of. I'm curious to know what style of mask she has, because there are various styles of masks. Some of which, you know, may cause more restriction or feel more restrictive than others. And so maybe trying a different style of mask would be helpful as well.
Okay. Dr. Greg, did you have anything on that particular thing?
No, you guys hit it right on the head. The settings and the fit of the mask were the first two things that I kind of think about. And there may be some value in looking at some of the anxiolytic, you know, obviously we're not don't know the full case, but if we're looking at, let's say like valerian root or, something like that, where
Right.
it's going to help calm that anxiety down, it may actually help her fall asleep. So that might be another route to look at,
Or some Maypop.
Some Maypop. Yes, Passiflora Maypop.
Nah,
Yeah,
pop
you've been
it.
watching. All
That's
right. So another question that we got, any remedy for uninterrupted sleep? That's actually a great question, because when people come to me, I usually ask two questions. So one question is, how much sleep are you getting? And the other, or do you have any trouble falling asleep? And then do you have trouble staying asleep? So, those are two completely different things. Being able to fall asleep but not being able to stay asleep is a thing. Docs, how do you guys address that? Dr. Jones?
Well, I think that, starting, I'm going to kind of hit this on two angles here. First, when I look at difficulty falling asleep, it's like, okay, why? Is your mind racing, right? Because that leads me to stress, okay, like, all right, well, the mind's racing, all that. Then I start thinking about, and I take it way back. It was like, okay, well, you have difficulty falling asleep. You drink coffee. Yeah. When was your last cup of coffee? Right. And like, oh, is it 5 o'clock? Forget about it. Right. I'm like, well, you need to be 10 hours, between your last cup of coffee and going to sleep. Yeah. All right. So next thing I ask, are you on any adrenal support? Especially if they're familiar with us naturopaths, right? When's the last time you took your adrenal support? Oh, I had one dose in the morning and my next one was like 6 o'clock at night, so that's not a good thing, right. Or if they're having B vitamins, right? I had my B complex and I had that later in the evening, right? So what are you doing leading up to the sleep event? Now, if they're talking about, and I'm definitely going to, this opens up an entire branch of stuff, right, that we're going to, probably talk about. Now, if you're waking up during sleep, now it's like, why? Are you waking up, you're a guy waking up to urinate? Okay, let's talk about your prostate. Let's talk about BPH, right? If you're a female patient, you're waking up, oh, you're having hot flashes or night sweats. Okay, how old are you, right? So now we're concerned about that, and so now it depends on why they're waking up. Oh, my partner tells me I don't notice I wake up, but my partner tells me I'm waking up during the night gasping for air. Now we're talking sleep apnea, right? So it really depends on why they're having difficulty falling asleep and what's waking them up that leads down the diagnosis pathway. Hopefully that I'll let you guys kind of take it from there. Yeah.
I agree. I think also something a little less physiological to consider is, do you sleep with electronics on or near your bed? Like, is your TV on? Is your phone by your bed and it's lighting up and that's what wakes you up? Do you sleep with the hallway light on and your door is propped open, and so that interrupts your sleep at night? So along with everything that Dr. Greg said, I think it's important to look at all of those factors as well. Like what's happening in your world around you that's causing you to wake up. Do you live in an apartment and your neighbors are fighting or getting it in late at night and it wakes you up? Like, paying attention to those. Listen, it can happen.
That was professional. That was a professional way of saying it.
Yes.
Listen, if you do you need to use like earplugs or something, Yeah, thank you, Nate. But looking at all of those things, and I know Dr. Turshá is probably more versed in it, but in Chinese medicine or Oriental medicine, they talk about different cycles, and there's things, there are herbs and things that they talk about as far as like the difference between having difficulty falling asleep and difficulty staying asleep.
Right.
I am not well versed in those. I just remember that there's something that they talk about. Somebody else somebody else can talk about it. That would be great. But the options are out there.
Yeah, I mean, we can get deep into the herbal, aspects of these things, and this is one of the reasons why it's important that you talk to your local naturopath, because we have more expertise in herbs than other physicians are going to have. Even in Western medicine, for instance, you may hear a doctor say, "Hey, take some melatonin," and that's great. I'm all for that, but we got to understand what that really means. Melatonin is actually good for keeping you asleep. It's actually good for you to stay asleep. And so we understand the particularities of these things. You look at an herb, for instance, I believe it's Melissa or lemon balm. I believe lemon balm is really good for people who are having those racing thoughts. It's very specific and particular for that. And so, you know, going with these different factors of sleep, we have to be specific and purposeful in how we're doing it. Okay, you just can't take, you know, just any old thing that somebody say, hey, it's gonna help you sleep. But we got to see what's in it, and we got to see how it works specifically for us in consultation with our local naturopath.
Actually, thank you, Dr. Gertrise. Well, thank you all for your responses. But Dr. Gertrise, you mentioned Chinese medicine. So if you are having trouble staying asleep, do assess, like, are you waking up, you know, in the middle of the night to urinate? Are you waking up jittery? Is your blood sugar dropping too low? And if that's the case, what did you eat, you know, before you went to bed? Or are you taking insulin and that's dropping your blood sugar? So that could have an effect. But if all of those things are free and clear, then talking to your naturopath or actually going to an acupuncturist will be great, because that could mean, like, each hour of the clock associates with certain organs in the body. And in Chinese medicine, if you're waking up at certain times of night, that could reflect on what organ, you know, certain organs in the Chinese medicine way of looking at it. And then they go from there to discover what's going on. So that could also help. Another question we got says, I take medicine for sleep, and after years of taking medicine, I still have a problem with sleeping. I'm on medicine for my back, so my pain management doctor was trying to lower my dosage, but all of the med that I've been given is not working. What can I do besides take medicines?
Okay.
So let's talk about pain management and sleep.
So I really wanted, can you hear me?
Yes.
Okay. Before you went on to the next question, I also wanted to emphasize about, you know, the lady who's having issues staying asleep. I know for personal experiences, when you tend to have an overwhelming reservoir of worry, that carries over while you sleep, meaning that you can wake up simply from worrying subconsciously and not even realize that that's what you're doing. And I know for me, before I go to sleep, I just can't lay down and just close my eyes and pass out. I think about the worries I've had that day, the previous day, what's you know, what's to come, and those same exact worries carry over during REM. And I realize those same worries also manifest in my dreams. And so I have nightmares. I start thinking about things that hasn't even happened yet. Like, I'm always playing out the worst case scenario. And I believe that if you are in a constant state of worry and anxiousness, that no doubtedly will affect your ability to stay thoroughly asleep throughout the entire night. And I think that should be one of the biggest, that should be the initial step, is trying to get whatever it is that you're consistently worried or anxious about under control.
Thank you.
Because I really believe nothing else will work until that is, you know, addressed.
So one of the tenets of naturopathic medicine is treat the cause. Another one is treat the whole person. So when we're talking about issues like sleep or any issues, we get a lot of information because we want to know what is causing this thing. And so if you do discover that it's worry, if, you know, it's anxiety about a situation, if it's your blood sugar dropping too low, any of those things, then your sleep will never be 100% until you address those other things. So the moral of this story is we need to figure out what it is that's causing you to wake up in the middle of the night, or what it is that's causing you to not be able to sleep well anyway, and go from there. And once we can get to that root, we can start to actually get you some better sleep.
Not to mention, over time, that will alter your cortisol levels like significantly, and that will just create another plethora of problems. So it's like,
yep, pain.
Sorry, yes, pain.
Anybody have recommendations for pain?
To help sleep, or as, what do you mean?
Just in general. Well, I'll read it again. Take medicine for sleep, and taking it for years. Also on, still have problems sleeping. Also on medication for pain. Tried to lower the dosage, but all of the medicines are not working. So what can be done for sleep? So in that
Did
case,
she specify any medication? I'm sorry. Did she specify any?
No.
No, she didn't.
Yeah, we can't get into that. That's
okay.
too many things.
Oh, no, it's okay. I just wanted to say, I know opioids, if it's a narcotic, has a tendency to keep people awake at night and to disrupt sleep patterns. Yeah. So that's the only reason why I was asking.
So again, if it's the pain, if it's the pain whether it's the pain causing the lack of sleep, or the medications that you're taking for pain can cause the lack of sleep, then we need to get the pain under control. And that can be things like decreasing inflammation. So that'll be food, that can be supplements, that can be herbs. It can be sometimes manipulation. So going to a chiropractor, a naturopathic doctor, or even a DO that knows manipulation and can help to heal your body that way. There can be certain injections. Now, I haven't done any injections in a while. Dr. Greg is more versed on that, but that can help to heal and correct some things. So it really would depend on that. Acupuncture is another one. Dr. Greg, do you have information on that?
Yeah, and really, I would start with what kind of pain it is, because, the way we can address it will be different if it's, nerve pain versus, arthritic or joint pain, right? So, because nerve pain is an entirely different beast right there. I mean, especially with sciatica, that is difficult. But speaking from my own personal experience, I hurt my lower back in medical school, and I had severe sciatica. I was limping around campus. It was so bad. I recall like laying down, balled up in a corner in class because I couldn't sit, and eventually I couldn't sleep, and got to the point where I actually was sleeping with a TENS unit in the bed to help relieve the sciatica. Nothing was resolving it. My grades dipped. It was just, it was a whole thing. And so I started looking at, okay, like I went down the path, I went to inflammation, right? Nerve inflammation. So I started looking at doing supplements that help with that, like alpha lipoic acid and turmeric and all of that. And it didn't happen overnight. I would also caution the person with the question is that if you're going down a natural route to treat pain, it's going to take some time. There aren't many things that are just going to knock it out like that. We have to be realistic and be consistent with it, right?
Absolutely.
And so now, and there's also injections that help with the nerve pain. So there's perineural injection therapy. We're actually trying to treat neural inflammation. Then there's, you mentioned injections. Like, those pain medications are not treating the root cause of the pain. They're not helping you heal. So we need to find out where's the pain coming from, right? Is it low back pain? Is it, knee pain? Is it shoulder pain? Is it arthritis? And look at ways to address that pain, because that is a cycle. You're in pain. Your cortisol spikes, you don't heal, you don't sleep, you heal when you sleep, you can't get out of the cycle. Yeah. So I would look at going back to what's causing the pain and how we can address that, So again, finding a good naturopathic doctor that specializes in regenerative medicine is a start, and just saying, hey, I need to get to the root cause. And then once you get that addressed, now you start coming off those medications, you start weaning off and improving that. So it's a very convoluted answer, a complex answer, because pain is not simple. Yeah. But I would definitely look at getting to the root cause and addressing that, and then using that foundation to come off of those medications.
Absolutely. So, the pain that you might feel like, and I don't know your case, of course, because we hadn't talked. But if you feel like your lack of sleep is caused because of the medications, then there's nothing you can do except address why you're taking the medications, because otherwise you're just going to be adding things on top. And so whether you add herbs or supplements or you add other medications, it's still the same idea. So trying to get to the root of what is happening will be the most beneficial. Does anybody else have something to chime in?
Oh yeah, if you don't mind.
All right.
Yeah, I thoroughly I'm lost. I can't even speak today. I am very, very an advocate for homeopathy for things like this. I was not a true believer in homeopathy until I actually had a remedy work on me. And actually, when I stepped away from the computer because I grabbed something, because still to this day, I have issues sleeping and staying asleep. Am I allowed to like show?
Sure.
Okay, cool. It's called Quietude. It's by Byron. And I will read you the ingredients. Hyoscyamus niger, Nux machata, passiflora, everybody knows passion flower, stramonium, and basically that's it. Basically take 2 tablets underneath the tongue an hour before bed, and it's non-habit forming. It doesn't make you drowsy. It just prepares your body for to wind down and to get some sleep. And I swear, this has worked wonders for me. And this is the last, I got this for free, and this was the last box that they had because I was at Dr. Fiore's office. And I'm so happy that I grabbed it because I used to, just to put my own medical history out there, I had really bad anxiety, and I was on Xanax for 3 years. And there were times where I literally could not fall asleep because I would be worried and anxious about so much that I would start hyperventilating. And you and Dr. Hamilton know, Dr. Gertrise and Dr. Hamilton know I have really bad asthma. And I would just, flare my asthma really bad. And so I got to the point where I was just tired of taking all the medication. And I was trying to find an alternative way to treat my anxiety, and not to go deep into, my constitutional, but I had a lot of trauma that I've never dealt with. And so I just to circle back to what I said before, to revert back, a lot of times when people have issues falling asleep, it's their subconscious trying to tell them something. It's deeply rooted. It's not something that's, it's superficial. It's something that manifests over time. But by the time you realize it, it's already deeply connected, into your psyche. And you really need to work through that before you can move on to anything else. Otherwise, you'll get mediocre results. And this is just my opinion.
Yes. So one person on another panel we did mention that it may take 2 to 3 months to regulate your sleep cycle. So for those of you who are on a healing journey to heal your level of sleep, know that it may not happen overnight. For some people it may, but it may not happen overnight, especially if you have some of these underlying causes of, lack of sleep. So just keep that in mind, that just because you're doing something and you're not getting good sleep within 2 days, you probably need to keep going, keep doing it, and building on that thing. Dr. Hubbard actually says, since you brought it up, is taking alcohol or cannabis to go to sleep okay? And someone else mentioned, I'm going to take Dr. Patrick's advice with the spirit beverage. Thanks for your help.
Oh, gosh.
So, Dr. Patrick, let's answer that question. Are cannabis and spirits okay to sleep?
Well, I'm so let me first say I'm not advocating drunkenness. Okay, I'm not saying that. Let me be clear on that. But having a small amount of wine or something like that, has been known to have effects, that sort of can bring you down to that level of sleep, that constitutional sleep in a sense. I would say, in terms of you said endocannabinoids, CBD, things of that nature. I mean, I think I'm a full advocate of those things. They definitely, we know that when you activate the endocannabinoid system, and it does promote healing and rest. It can help to lead towards sleep. So I'm a complete component of that. I'm not, listen, I'm not telling you to go smoke things and all that sort of thing. I'm not saying, I'm not saying you do all that. But, there are some products, full and broad spectrum that do not have the THC, so you won't get fired from your job. Okay?
Right.
That do not have the THC in it that would help. And I've had several patients who've benefited greatly from those products.
Okay. Dr. Gertrise, thoughts?
Yeah, I would say as far as the alcohol goes, like if you have a lot of alcohol, it can help you go to sleep, but you won't have restful sleep. It actually disrupts sleep. So I would not recommend getting drunk, trying to go to sleep, because you'll go to sleep. You'll go to sleep. It just won't be restful. It's not the type of sleep that you need. It's not the restorative, regenerative sleep that you need.
I agree.
And I think what what Dr. Thompson, Dr. Patrick is doing is really, when he's having the glass of spirits, or anybody that's having the CBD, what you're doing is actually helping yourself. It's a way to help calm yourself down. It's a way to help level you out from your daytime. And so you can put it as a part of your sleep routine as a way to calm down. But it's not saying, oh, you go in on this so that you can go to sleep. But it's just another way of calming you down, or promoting rest or relaxation in you so that you can fall asleep. So don't, like Dr. Patrick said, we're not saying go out there and just all this stuff up and say, this is how I sleep, this is my sleep regimen. Like, no, like, this is just helping you to relax a little bit. That's what it is.
These doctors say,
right, listen, because people will say it.
That
people will say that is not what we're doing. That's not.
But I mean, has anybody tried like simple things like, like a hot bath with Epsom salt, or like a hot shower, things like that, where, cotton clothing, 100% cotton clothing, let your body be able to breathe through the fabric. Reading, maybe, maybe listening to some, winding down, tunes like they have on like YouTube, just to help you sleep. I just think that we live in such a hectic and fast moving life that our brains try so hard to compensate to keep up. And by the time it's time for us to wind down, our brains are still moving at 200 miles per hour, plus everything else that we maybe be worried about. I just think there's not one size, fit all approach, to remedying better sleep and to stay asleep. I think it's a majority of factors, and each one of us has our unique version of those factors. But it is safe to say that there is one common denominator that links us all together. And I really believe it is underlying trauma.
Okay. Dr. Jones, any thoughts?
Well, and I think Dr. G hit it on the head that, alcohol does make you fall asleep faster. That's true. And that you don't get that, the REM sleep, right? So you don't get that restorative sleep, but, and now on the CBD, and we're all adults here, let's talk, on the cannabis level. And again, obviously sleep, insomnia is not on the state of Arizona list of recommended conditions for cannabis, but we're adults here and people are using it for sleep, right? And the issue is that just like alcohol, it will help people fall asleep, and it's great. But the research shows that you don't get to the REM sleep with cannabis as well, although it does also says for long-term use, when you stop, you get the rebound REM sleep. So that being said, I mean, our CBD and cannabis, and like, I would never recommend, hey, have a drink before bed. But at the end of the day, we just have to educate our patients and be, and one thing about, when they're in my room, it's like, look, I need all the truth all the time when you're in this room. I need to know what you're doing. I'm not here to judge, don't lie, to, your attorney, your lawyer, and your wife, or husband, both ways. But at the end of the day, you just want to know so you can educate that person and say, hey, just know this is what's happening, right? It's just, that's our goal. That's our job. Just, let me educate you on that. So agree with all the points that were made.
My personal thought is not to use alcoholic beverages or CBD, THC, cannabis products for sleep all the time. Occasionally, maybe. The problem is that then you become dependent on that in order to sleep if using it long term, because then it's another Band-Aid. It's not treating the root. If the problem is that you need to wind down, then let's put some things in place so that your body can start preparing. That will be more of the sleep hygiene. That might be starting to turn lights off. That might be handling some of the trauma of the day. learning how to leave everything outside, and not bring it into the house. Like, learning some of these things can help. Or, changing the diet or using herbs to help correct certain things in the body. So that is my take on it. My personal take is I would never recommend those things for sleep purposes, because then they can become a crutch. And you're still not treating the cause. And I didn't even realize that these can disrupt REM sleep. So that deep restorative sleep, you're still not getting it. You're falling asleep, but you're not getting it. Let's see.
Even melatonin's up there.
Pardon me?
I said even melatonin's up there. I mean, people become way too dependent on melatonin.
Right.
I agree with that.
Absolutely.
Right. And melatonin is one of those chemicals that your body actually makes on its own, but it needs darkness.
Right.
Darkness.
Pineal gland.
So, what'd you say, Dr. Thompson?
Pineal gland.
Yes. So you need complete darkness. So we'll talk about, again, in a few minutes, we'll get into the sleep hygiene portion. But know that your body needs complete darkness in order to produce the proper amount of melatonin to help. You also need to decrease your cortisol levels, so your stress hormone levels, in order for that balance to work well. So again, dealing with the stress and the pressures of the day will be helpful, and having a sleep hygiene routine will be beneficial. Let me get to a couple more questions. How important now is it for those of us with underlying health conditions to visit a local naturopathic doctor? Aha, great question. A lot of people that I know are having sleep issues, falling and staying asleep and waking up. My personal thought is everyone needs to see a naturopathic doctor for everything.
Absolutely.
Even if we are one person on your team, because we see health from a different lens than other doctors do. And so having a naturopathic doctor on your team can help to fill in the gaps in some places. They can help direct things in a way that conventional docs, allopathic doctors cannot. Not to say that we are doing things better or worse, we just do things differently in a lot of situations. Other docs want to answer that question.
Yes, our medicine is dynamic. It is we have so many different modalities we can use. And I think people are so quick to write us off just because of what they hear and not research on their own, And of course, we have people out there that try to discredit us by any means necessary. And I think it's up to us and our community to educate, which is what Dr. Greg and Patrick were saying. That is our primary job, is to educate the patient, is to teach them how to take care of themselves and let them know what they can do besides solely relying on their PCP. Because I think as a country, we've become so accustomed to the quick fix, which is the pill, and thank God people are starting to become more aware of, of big pharma and their agenda, and to keep people managed and not, and not treat the root cause, is what we call it, I think there is so much work that needs to be done to the general public. And we can start, I don't know, Gertrise, how can we start, Dr. G?
What do you mean we can start? What are you referring to?
You mean like educating people? Panel discussions like this and forums are a great way to start. But I agree with what you both are saying, Dr. Hamilton and Dr. Woollery, that it's important that you at least have a naturopathic physician on your team. Even if you're not ready to jump all the way out there, at least having someone with a different perspective on your team to be able to help guide you, and that has a different vantage point to be able to help.
Yeah, I definitely agree with everything everybody's saying, and I think it's very clear that those of us who are on this panel have kind of integrative thoughts about medicine, and we're understanding that. So with that being said, I think it's also very important in terms of that team thing to understand that not only do we have a different perspective or have a difference in our perspective on medicine. But we also have some different tools that you won't find in conventional medicine. And I say this to patients all the time. One of the things is that conventional medicine basically has two main basic tools, which is drugs and surgery. Some basic tools, whereas your naturopathic physician is going to be able to do things that has a wider tool belt, which may include everything from botanical medicines to homeopathy to physical medicine like chiropractic. It could be traditional Chinese medicine, it could be acupuncture, it could be even some minor surgeries for some of us. So we just have a different perspective, but also more tools.
So the question was asked about insurance and naturopathic doctors. So I can give a quick answer.
Let's sit this one out. Because I don't even know.
It really depends on the doctor, and it depends on the location. So when I was in Arizona, I was looked at as a primary care doctor, had full scope of practice, and I could take insurance. I didn't personally, but it really depends on where you are. And not every insurance company will take naturopathic doctors. So one, you have to look at your location, and are naturopathic doctors' licenses recognized in your location? And I know 4 of us are not in states where, they are recognized. So for us, insurance wouldn't be an option. Dr. Jones is in Arizona, so he could potentially take insurance. Do you take insurance, Dr. Jones? No, so he does not take insurance. So in that situation, what can happen is you would see someone like Dr. Jones, and you would basically submit your own paperwork for insurance, and they would reimburse you directly, however much they're going to reimburse you. So a doctor like Dr. Jones will just give you a receipt with the information, with the codes that are needed. Then you submit it and you bring it back. So it really depends. A lot of naturopaths, a lot of doctors are, either not taking insurance or giving insurance a side eye because they don't like to pay people. And they like to hold on to your money, and they like to dictate how you practice.
Right.
So there's that. It can be an issue, but no, it really, not all naturopaths take insurance, not all insurances take naturopaths, and it depends on your location. Anybody else have a thing to add?
Yeah, nobody likes paying anybody, because I sure as hell don't. I'm sorry, I was trying to say that.
There's that. So another question that I got and was basically about quietude. Is quietude, what's the difference between quietude and melatonin? So quietude is a homeopathic remedy. It is a collection of homeopathic remedies. Melatonin is a hormone that your body actually produces. So it is 2 completely different things, 2 completely different ways to look at, restoring sleep from 2 different angles. And that's what Dr. Patrick was talking about when we say we have more tools in our toolkit. So homeopathy is one, herbs are one, nutrients are another. The hormone therapy, depending on what it is, vitamin, nutrient, hormones is another. So yeah, though that's the difference between the 2 of those. Let's see. I've been taking melatonin and still do not feel that I'm getting adequate and quality sleep. Okay, so if you're not getting quality sleep, think about the fact that there are several different factors that can be causing your lack of sleep, as we mentioned. So trying another remedy can definitely be helpful, but it may not be the only thing. It might be one of these underlying things. Anybody have something to mention about that?
No, I agree with you. It could definitely be something underlying. And also the melatonin, like depending on how long you've been taking it, is the effectiveness still there, so it's a matter of really figuring out what works for you, and also figuring out what your underlying cause is for why you're not getting sleep. Taking the melatonin is going to be, like Dr. Turshá said a while ago, it's just going to be another Band-Aid if you don't figure out what it is that's preventing you from being able to sleep and get that restful sleep.
All right. Let's go ahead and start talking about the sleep hygiene.
Mhm.
We know that sleep hygiene is important, but most people don't know what sleep hygiene is. So can each of you kind of give your brief description of what sleep hygiene is? Brief.
Well, I mean, I'll just say, sleep hygiene is just a way to, it describes your method or your routine as you're approaching your sleep time, and addressing the various factors that we've already discussed.
Okay.
I just like to think of sleep hygiene as your regimen to obtaining better quality sleep, just as if you were following a specific diet or an exercise program. You always follow or abide by those set guidelines. Otherwise, you won't see the results that you're looking for or that you desperately want. So, I mean, simple things as avoiding stimulants.
We'll
Going
get
to
into
bed.
the specifics in just a second.
Oh, sorry, yeah, but that's basically it.
All right,
Yeah.
Dr. Jones, how do you describe sleep hygiene?
Just, setting a routine, whether it be, what time do you go to bed, what's in the room, what's not in the room, the temperature of the room, just all, whether it be, avoiding things that stimulate you before bed. It's a cluster of things, but I think routine is a big part of it for me.
Right. Dr. Gertrise?
I agree with everybody as far as like it's about setting a routine, but it's basically those things that you do to promote a restful night's sleep is basically what sleep hygiene is.
So what I'd like you guys to do now is tell us one thing that you consider very important as a part of a sleep hygiene routine. And if we can try not to overlap, that'd be awesome. Cynthia says, is it true that cell phones can affect our sleep? And that's basically where why I kind of segued into the sleep hygiene piece now. So, who wants to go first?
I'll go. I think the one of the main things I would say is well, I don't want to say that since you've already said the whole technology piece, but one thing is just to make sure that you have the right lighting. The right lighting, I think, is a very important element, simply because the lighting can stimulate your mind and can also reduce the production of melatonin in your body. And so that's something I think you should make sure the lighting is kind of a lower, no super bright lights and things of that nature.
Okay. Dr. Gertrise, what is your favorite sleep hygiene thing?
Favorite? Oh my gosh. I would say I feel like I'm on the spot now and I have to pick one. Let's see. Probably for me, it would be perhaps journaling. So clearing your mind of those things that you are going through throughout the day, or like Dr. Nate talked about earlier. We carry these worries. Sorry, I'm too familiar. That's what it is. But carrying those worries and things, from the past or throughout the day with you into the bed. And so journaling is a way to get those things out of your head so that you can begin to wind down and relax. So journaling would be one of the main things that I would recommend.
All right. Dr. Nate?
Now this may seem very inappropriate. I don't think it is because it's natural, but masturbation for me works. I know built up stress and if you've been celibate for a period of time, and masturbation has all around benefits, but for the sake of sleep, it does help me unwind and de-stress tremendously. And that way I'm not even thinking about sex at that time anymore, and how often men think about sex in a day. We're not going to get into that conversation, but it's a lot.
Okay.
But yeah, sexual frustration is a big big factor for sleep abnormalities. So,
right. Thank you, Dr.
Yeah.
Jones. You're still muted.
Yeah, there we are. There we are. I would look at room temperature. I know that a lot of the sleep studies say between 65 and 72 degrees. I know like this cooler is better. I think it's harder to sleep when the room's hot, but also I can't sleep when it's too cold either. So just kind of everyone's going to be different, right? So I'd probably start with 70, 69, 68, and just, go down till you find that temperature where it's like, yeah, this is good for me. That's the one I would look at. That would be my input for today.
And to address your question specifically about cell phones. So as I mentioned earlier, all light can affect your sleep. Even like the little bitty light that's on the television when it's off, like the little blue light that's on the on button, or the light from digital clocks, or the little indicators from cell phones, the EMFs, the frequencies that your cell phone and other devices emit can affect sleep. So optimally, you want to remove all the electronics from your bed. Your bedroom should be for sleeping and sex only, so that when you go into your bedroom, your body knows that this is the time that we're either going to have sex or we're going to go to sleep. We're not going to do homework. We're not going to work on our project. We're not going to work on anything else. That would be a part of sleep hygiene, and just making it extremely dark in the room, having the right temperature, having your journal there so that if your mind is racing, you can clear it, and setting a routine so that you're going to bed at a certain time is most helpful. Let me make sure that there aren't any other questions. Okay, Wanda says, I went to a sleep conference and the doctor said because melatonin is time released, you have to take it 3 to 4 hours before you go to bed. It doesn't really work until 2 or 3 a.m. Not all melatonin is time released.
Right.
Some melatonin is most melatonin is not time released. So you take it and it should work within a few minutes. Time released melatonin, is so for people like if you wake up later in the night, time release can help you to either not wake up at that time or fall back to sleep more easily. But that's the point of the time release. Anybody have any other thoughts on that?
Yeah, I was going to ask to the individual who's using melatonin to help sleep, is he or she taking the melatonin alone, or is it formulated with other supplements like 5-HTP or L-theanine? Those things, melatonin alone is a great supplement, but when combined, it works synergistically with other formulas, if that makes sense. At least in my experience, it has. Specifically passion flower. But
makes sense, because again, depending on why you are having sleep issues, having those other things on board can address sleep issues from different angles. The last thing that I want to talk about is we touched on it, is the sleep apnea. As we get older, as we gain more weight, we meaning humans in America, as we get older, as we gain more weight, we gain more internal flesh that causes more problems in sleep. Have you guys thought of, or what do you say to your patients who have sleep apnea?
I've never had a patient who had sleep apnea.
Okay.
Just a Janae patient, which was really cool, but yeah.
Okay.
Well, I mean, one of the things I say to patients is that, first of all, sleep apnea is a very serious thing. It can be a very serious thing, and try to explain to them exactly what's happening with that. That literally, there are moments while you're trying to sleep that you literally stop breathing, and so that's I mean, that in of itself should hopefully motivate somebody to want to take some action on that. But to let first of all, I want to confirm that you do have sleep apnea. I would recommend doing like a sleep study to make sure and see what that's looking like. And then you know, if that CPAP is, you know, is some sort of machine to do that, as we've already sort of talked about, making sure it's on the right settings, and to also ensure that it's not the end of the world, that with proper diet and exercise, weight loss, and things of that nature, that, you know, you can get to a point where you don't need it anymore. And I would say that's what I want us to get to in our journey.
Dr. Jones, were you about to say something?
Yeah, I think when it comes to the few patients I've had with sleep apnea or considering sleep apnea treatment, it's like, okay, you know, if you're considering it and you think you have it, you do the sleep study, right? 'Cause you want to confirm the diagnosis, because
Right.
as Dr. Thompson said, it's no joke. It's nothing to play with, because
Right.
you have sleep apnea, it lowers your oxygen saturation. Now it raises your blood pressure, right? And that leads to all types of cardiovascular disease and all that. And again, in our male patients, sleep apnea is going to lower their testosterone. You know, so that's another issue as well. And it's going to raise a hematocrit that leads to other cardiovascular issues, right? So,
Right.
you know, now we have the diagnosis, and it's like, okay, so what's going on here? Like, you know, obviously there's the airway piece of it as well. But what if our patient's overweight? You know, so it's like, okay, now it's like, okay, like, you know, losing some weight can help with that. Are you drinking before bed? You know, that's going to worsen sleep apnea, right? So, you know, are you living a healthy lifestyle? Are you exercising, right? So all things to kind of help that oxygen production as well. And so I know we mentioned the chiropractic or the cervical adjustments as well. So I kind of start with that lifestyle stuff, like, you know, sleep hygiene, stop drinking before bed. Let's work on a sustainable weight loss plan that you can handle. And I've seen people get off the CPAP doing that, you know. So I think there's a matter of they have to invest in that and not just say, hey, I'm on this mask and this is my life sentence, because it doesn't have to be in a lot of cases. So just, you know, like I said, understand the severity of it. Now let's make a plan and let's get to it. That's how I've been approaching it. So,
Dr. Gertrise?
I agree with everyone else. Just making sure that people are definitely taking it seriously, along with, you know, of course, everything that Dr. Thompson and Dr. Greg have said. But just making sure that you are taking it seriously, taking the steps to improve, and understanding that it's a process. You know, coming off of the CPAP and improving lifestyle changes and all of those things is a process. So understanding that, you know, being patient with yourself during the process, and then taking the process seriously, because it's not going to happen overnight. So you definitely have to make sure that you're taking the process seriously.
Yes. So for me, two issues to consider, aside from what was already mentioned. One is inflammation. So inflammation body-wide, we may not realize that there's a lot of inflammation in the body, but inflammation can be causing the extra fleshiness in the throat. So doing the things that will decrease inflammation will be key, will be huge. And that can be from a dietary standpoint, finding out what your body is being, you know, what is causing the inflammation in your body dietarily, as well as, you know, using herbs and supplements that help to decrease inflammation and other things. So inflammation would be one. And mucus production, decreasing the amount of mucus that your body produces. And again, that can be diet. That's huge in that. So if you can do those two things, and, you know, add a couple other things, you can you can start to heal better from sleep apnea, because it is serious. People do stop sleeping and it's very disruptive. It also causes hypertension, right? Because if you're not breathing, for one, it's a panic state when you're not breathing. So your body is in panic mode every time you stop breathing. And if that's happening several times a night, every night, then your body is constantly panicked, and then you're not getting enough sleep. And so that becomes a stress state. So definitely, if you have sleep apnea, you want to take it seriously and work on some things so that that can help you to sleep better. Other things would be like white noise does help sleeping better. Nature sounds, if you have that available, can help you to sleep. Like if people can't sleep in complete quiet, you want the sounds of nature or background noises. Any other thing that you want to add that will help somebody with a good sleep hygiene routine, Doc?
Yeah, I mean, going along with what you were saying, great options. Anything that may be soothing. Audio. You mentioned those things. One thing I've recommended people is to listen to like some soft, positive affirmations at night. Just listen to, somebody's soothing voice saying, "I am great. I am wealthy. I am this." That stuff seeps into your consciousness and helps you to sleep. Secondly, also, you want to consider, some sort of visor to block out light and maybe helpful for some people who may be in situations. I know people, for instance, who live in places where their blinds are woefully deficient. Their blinds are blocking out nothing. So with that being said, just as simple as putting on that face mask to block out any light can be also helpful.
Anybody else have a quick recommendation?
Aromatherapy as well. So maybe like having a diffuser. If you don't have a diffuser, maybe like a little cotton ball with a couple of drops of essential oil near your bed will be helpful. So like lavender, passion flower, chamomile, those things, jade, jasmine, not jade, jasmine. I don't know why I said jade, jasmine. And just, or if you find a good sleep blend of essential oils that works for you, doing that as well. So aromatherapy is also really good.
Dr. Nate, do you have any quick recommendations for sleep? You're muted. Hold up. All right.
Hey, yeah. So for me, I like to read before I go to bed, but I have to make sure it's a book that is very dense, where I don't get too wrapped up into reading for long periods of time. Even though sometimes reading does make me sleepy, but I mean, I love you, Lord, but the Bible is a perfect example. I mean, just read a scripture or two, and you know what I'm saying, you out. You out. Also, I like to practice deep breathing exercises. A lot of times after we come home from a long day at work, whether it be very stressful or if you just have, lingering worries, like I said, those things can manifest into your ability to sleep and to sleep thoroughly. So to de-stress from all that, I really suggest just practicing your breathing, belly breathing, slow, deep breaths, and inhale and exhale. I mean, it's pretty self-explanatory, but there's also self-guided meditation, which is really, really, really helpful on YouTube. They have plenty of channels that can help you with that. And also, try drinking. I like kava tea. Kava is really, really good for anxiety and to de-stress. Even though it tastes horrible, it's really good stuff.
All right, thank you. Dr. Jones.
Yeah.
Sorry, you got to repeat that question for me. I'm so sorry. My bad.
All right. We about to wrap it up.
When multitasking goes wrong, I'm so sorry.
we about to wrap it up. So there's that.
I feel like it's back in school again. This might have happened to me at SCNM quite a few times. It's like,
I'm having a flashback.
Yes.
So yes.
No.
Let's see. What was the question? Any last tips on sleep hygiene that we hadn't mentioned?
No, I think we pretty much hit the big things on the hygiene things. And okay. I guess I know where time is running a little bit limited as well, but I think, one thing that I would mention that, this is a hygiene thing that it may seem like a hygiene thing, but it's a hormonal thing if our female patients are having night sweats or hot flashes, right? Yeah. Mm-hmm. And it's like, well, I don't know why I'm having night. And it's like, it's not the temperature, it's the fact that you don't have estrogen. And this is why this is, what's happening, right? So I would definitely make sure that we are able to differentiate between, temperature in the room and a hot flash for those patients.
Perfect. Yeah. All right. So we're going to wrap it up because we've been on for about an hour and a half now. Thank you all for sticking with us this long. I definitely appreciate it. I hope we answered as many of your questions as we could. Having a comfortable mattress and pillow can also make a difference. Absolutely. Thank you, because we didn't mention that. Appreciate that.
Oh yeah, the pillow between the legs.
So please, docs, tell us how people can find you. Let's start with Dr. G.
Can I plug my ebook?
Sure.
Okay, great. So you can find me on social media at Whole You with G. I have a Facebook group, Whole You with Dr. G. You can go to my website, www.wholeyouwithdrg.com, where if you sign up for my email list, you can actually get my ebook called Clean Sleep, which actually helps you to set up your nighttime sleep routine. So yeah, there's that.
Excellent.
Ready to get that so I can support you, Dr. G.
All right.
Thank you.
Who's next?
Nate Woollery on Facebook. Bam.
All right. You can find Dr. Woollery at Nate Woollery on Facebook. Dr. Thompson.
Yes, you can find me at my website, www.wholekingdom.org.
Yes.
WHOLEKingdom.org. I'll have a Facebook page, Whole Kingdom Wellness. You can also find me on Instagram at Whole Kingdom Wellness as well. So, I invite you to please contact me. I'd love to work with you, talk with you. Thanks so much.
Absolutely. And Dr. Jones.
Hey, my Instagram is Dr. Jones _ Dr. Jones, all spelled out. And then I just launched my YouTube channel last week. Got the first video up, and it's under Dr. Jones NMD TV. So that's Dr. Jones NMD TV on YouTube. So I hope you guys can follow along there, and I hope to see you guys soon.
All right. And you can reach me at Dr. Turshá on social media. That's DrTursha on Facebook, Instagram, Twitter, YouTube, at Dr. Turshá. My website is www.drturshá.com. You can also contact us follow us on at Indies of Color, both on Facebook and Instagram, and we will be highlighting naturopathic doctors of color, all the work that they're doing, all the events they have, so you can keep up with us there. If you have questions about specific doctors, reach out to us, and if we can't help you, we will send you to someone who can, or refer you to someone who can, who's in your area. So just let us know. Most of us do work remotely. So if you want to get in touch with any one of us, you can just reach us at the information that was just posted here. And again, if you need more information about contacting someone in your area, if there's something that cannot be done remotely, just reach out to us and we will be happy to help you. Thank you for joining us. We will be back next week. It'll probably be a different cast of characters. So join us every Sunday around the same time, talking about things that we think you want to hear. So that's that. Take care, and we appreciate you for being here.
Ain't nobody coming to see you, Otis.
All right. Y'all have a great evening. God bless.